Hello everyone, this is Dr. Mandeep and welcome back to Clinical Case Series with Nextillo. So last time we were discussing a patient and that patient was a 48-year-old female with nausea and vomiting. She had headaches, breast pain, her breasts were tender, enlarged, and a whitish material could be expressed through the nipples. And then for her vitals, the blood pressure was 130 by 80. The pulse rate was 68. The respiratory rate was 18. The saturation was 98% on room air. The temperature was 98 Fahrenheit. And for her labs, she had hyponatremia. And after solving the question for the last video, we came to know that hyponatremia was euvolemic. We had also discussed that in euvolemic hyponatremia, the total body water increases, due to which there is dilution of sodium. Now, what are the conditions where euvolemic hyponatremia happens? And that is where we'll get the answer to the question towards the end of the last video. So let's find out the cause. Now, there are 4 commonly tested conditions for euvolemic hyponatremia, and these are Addison's. The second one is psychogenic polydipsia. The third one is hypothyroidism. And the last one is SIADH. These 4 conditions are commonly tested, and we will dive into each of these so that we can find what's the cause in this patient. So let's discuss Addison's first. For Addison's disease, the adrenal glands, they are involved. If this is the adrenal gland and this is the medulla and this is the cortex, the adrenal cortex is involved in Addison's disease, which synthesizes 3 hormones. These 3 hormones are cortisol, aldosterone, and sex steroids. Now, if Addison's disease involves the cortex of the adrenal gland, the synthesis of all of these 3 hormones will decrease. Let's discuss what happens when cortisol decreases. Decrease cortisol will affect three things. And these are ADH, CRH, and ACTH. It is because these three hormones are under negative feedback regulation. So when cortisol decreases, these three hormones which are negatively regulated by cortisol, they will increase. So what happens when ADH is increased? It increases water absorption. Which would lead to hyponatremia, right? So I think we have solved the mystery. Not yet. Let's go further. For CRH, increased CRH increases ADH, which would in turn increase water absorption and lead to hyponatremia. The second effect is that CRH is released, causing more ACTH released from the anterior pituitary. And CRH is made in hypothalamus. Now, let's see what increase ACTH does. ACTH, it stimulates the melanocytes to increase melanin, which would cause skin hyperpigmentation. So we have seen that increase ADH causes water absorption, CRH increases ACTH and ADH, while increase in ACTH increases melanin and causes skin hyperpigmentation. Now let's see what decrease aldosterone does. Decrease aldosterone leads to three effects. These are sodium loss, potassium and hydrogen retention. Now, once these three effects are seen, what would you get? You would get hyponatremia, hyperkalemia, and acidosis. So, in Addison's disease, you would get hyponatremia, hyperkalemia, acidosis, and skin hyperpigmentation, which is not seen in this patient. So we can cross out Addison's disease as a cause of euvolemic hyponatremia in this case. I hope everyone got this clear that Addison's is not the cause in this patient, right? So let's move on to the second differential. The second differential is the psychogenic polydipsia. So in psychogenic polydipsia, usually there's an underlying psychiatric condition which leads to increased water intake resulting in decreased sodium concentration in the body, hence the hyponatremia. So, if we review this case, our case, which is a 48-year-old female, she doesn't have any psychiatric condition, nor does she take any amount of water or extra water. So we can conclude that polydipsia is not the cause of hyponatremia here. Let's move on to hypothyroidism. So, for hypothyroidism, the circulating levels, the circulating levels of thyroid hormones, especially the free T3 and T4, they decrease. Now, when these hormones they decrease, the basal metabolic rate falls. The basal metabolic rate falls, resulting in slowing down of the body. Slowing down of the body. Now, what does this slow mean? What does slow body mean? So, the heart rate falls, the gut becomes slow, so it becomes constipated. Because the brain becomes slow, the person becomes sleepy. And since the metabolic rate is low, the body's heat production slows down and the person becomes cold intolerant. Now, how does hypothyroidism causes hyponatremia? As we know, as the body slows down, the heart rate slows down, resulting in decreased cardiac output. Decreased cardiac output. This decreased cardiac output is sensed by baroreceptors. Once they sense that the pressure within the blood vessel is falling, the firing decreases and the brain senses that it should release ADH so as to make up for the blood volume so that the blood pressure is maintained. It also activates the sympathetic nervous system as a compensation. So, as we know, as the ADH increases, water absorption increases and it would result in hyponatremia. Let's go back to a question of this patient where she's a 48 female. She doesn't have bradycardia, she doesn't feel constipated, she doesn't feel sleepy, nor she is cold intolerant. So, hypothyroidism is not the cause here. So, what are we left with? We are left with SIADH. So, this is the cause of hyponatremia in this patient. So, let's delve into that. So, SIADH, syndrome of inappropriate ADH secretion. Syndrome of inappropriate ADH secretion. So, what do you think is causing increased ADH in this patient? She has a headache, breast pain, breasts are tender, enlarged, and there's a whitish material coming out of the nipples. If there's a headache, something must be in the head. And what is that? Breasts are painful, they are tender, they are enlarged, and a white material. What does that indicate? Galactoria. Now, this patient has a headache and galactoria. So, which hormone causes galactoria? Prolactin, and headache. Is there something in the head which produces prolactin? It's pituitary gland, right? So, something in the head which is producing prolactin, which is the anterior pituitary gland. So, where we can go with this? It is a pituitary adenoma. So, I have a question for all of you. This is where the discussion ends. How can you confirm the diagnosis of pituitary adenoma? I hope this was a great learning experience for all of you, and goodbye.